Mr. Jones is a gentleman who's come into hospital complaining of chest pain. Natasha is the nurse on duty this day. He's been complaining of palpitations. Natasha is now going to be checking his pulse to check for irregularities, and she's also going to give the patient some reassurance. She's communicating with Mr. Jones throughout this procedure. Now she's going to be checking his oxygen system to make sure there's adequate oxygen. Again, she will check the pulse. She's now going to go ahead and apply a 12-lead ECG to the patient and explaining the procedure throughout. She's now applying the ECG dots, which is an adhesive sticky tape which applies to various parts of the anatomy, the wrists, the ankles, and across the torso, radiating around the left side of the breast. Through this procedure, Natasha will be communicating and instructing the patient of what she's doing at all times. This section, Natasha will be applying the correct limb leads, and as you can see from the monitor, the heart rate is now increased up to 159 beats a minute. And oxygenation slightly decreased. Patient is complaining of shortness of breath, and Natasha again starts commencing the 12-lead ECG. Once the leads have all been applied in the correct manner, Natasha will instruct the patient to take a deep breath and be quiet because of the vibration which goes through the 12-lead ECG machine to get a correct reading. Natasha just checks that all the leads are in the correct position before she presses the on button to the machine to print off a readout. Natasha is now taking the reading. The 12-lead ECG has been completed. She now removes all the attachments, gives the patient some reassurance, and she will inform the doctor of the findings of the 12-lead ECG. Again, she will give the patient reassurance and sit them up, reapply the gown, and wait for further instructions.